Hello, I'm Mohammad Garipur. Along with Caitlin de Klerk, I co-founded the Epidemic Urbanism Initiative in 2020 at the start of the COVID-19 pandemic to create dialogue around issues related to architecture, space, urbanism, and their relationship to epidemic diseases. It's my pleasure to welcome you to today's webinar with the jury, commentators, and finalists of the 2023 Epidemic Urbanism Initiative International Design Competition, with a focus on adaptive reuse and health equity in localized contexts in the category of Community Health Center. I want to offer our thanks to the EUI coordinator, Angela Anderson, and our wonderful colleagues who you will meet in just a moment, who have generously shared their time to review the competition submissions in this category, to our sponsors and partners, EDRA, the National Center for Smart Growth, CRGA Design, Grimm and Parker Architecture, and Cunningham, to all the teams who submitted their designs, and to all members of the epidemic urbanism community who represent more than 90 countries. Since 2020, the EUI has grown to include a board of experts, more than 1,900 scholars and professionals, and a team of regional liaisons from more than 75 countries. Following the publication of an award-winning volume on architecture and urban epidemics, a series of workshops, symposia, and panels, a successful design competition in 2021, and the creation of a growing archive of resources accessible on our website and YouTube page, the EUI has now become a didactic hub with a broader focus on the implications of the relationship between health, equity, and the built environment. Scholars, educators, practitioners, and others interested in health and architecture may access learning materials and archives. The second category in this competition, the Emergency Treatment Center category, will also be featured in a webinar available on our website and YouTube channel. I now turn to the EUI's program coordinator, Dr. Angela Anderson, to introduce the 2023 design competition and our Community Health Center team.
Hello, everyone. In 2023, we called a design competition based on healthcare in the categories of Community Health Center and Emergency Treatment Center. Submitting teams were asked to focus on adaptive reuse of local sites and spaces and to include members from design and healthcare at various stages of their careers. We received close to 70 submissions from teams in Hong Kong, Canada, China, Germany, India, Indonesia, Malaysia, Mexico, Nigeria, Pakistan, the Philippines, the Russian Federation, Saudi Arabia, Uganda, the U.A.E, and the U.S.A. This is tremendous proof of how collaborative projects can create real architectural solutions to caring for the well-being of communities in every part of the globe. The talented creative people working in design fields and healthcare are also leading the way in creating healthcare sites suited to the climate and environment, available resources, cultural needs, and social expectations of their communities. Students, academic instructors, practicing architects, medical professionals, and administrators and other skilled team members work together to submit meaningful projects. We're grateful to our colleagues, and especially to Dr. Ashraf Salama for playing a role in screening the first round of submissions. It's my pleasure to introduce the chair, jury, and commentators who have met and consulted regularly over the summer to review each project. We've appreciated the dedication of the chair of this category, Luisa Yaropchi, who is an assistant professor at the Department of Architecture at the University of Washington in Seattle in the United States. She's a board member of the Epidemic Urbanism Initiative and licensed architect who has worked in architectural firms in Toronto, New York, and Boston. Serving on the jury is Adam Bresnik, a practicing architect and educator based in Madrid, Spain, who has developed residential and commercial projects around the world for over 30 years. He has taught various aspects of architecture and design for over 25 years in Spain. Juror Thomas Fisher is a professor in the School of Architecture and the director of the University of Minnesota's Design Center in the United States. He published a book in 2022 on the impact that pandemics can have on built environments called Space, Structures, and Design in a Post-Pandemic World. And jury member Alain Delany in Sweden is a founder of the International Academy for Health, Design and Health, the IADH, and the journal World Health Design. He's a global authority on the interaction between design and health, developing salutogenic design approaches in both medical and design institutions worldwide. Commentator Lindsay McComb, a PhD, is a professor of psychology at Vancouver Island University in Canada and the past chair of the Environmental Design Research Association. She's also the chair of the Environmental Psychology section of the Canadian Psychological Association and the co-editor-in-chief of the Journal of Environmental Psychology. Commentator Giselle Sabat, based in the United States, is the executive director of the International Society for Urban Health. She's a globally recognized urban health leader with more than 15 years of experience advising governments, multilaterals, NGOs, and private sector companies to develop sustainable, inclusive, and resilient cities that promote and enhance resident health. We now turn to Luisa Yarrochi, who will discuss the jury process before we view the short design videos from the finalists, learn the winning design, and hear from the jury and commentators.
Welcome, everyone. It's my pleasure to be here and to have had this opportunity to serve as chair of this remarkable jury and commentators. It is my task to announce the results of the Epidemic Urbanism 2023 International Design Competition in the Community Health category. So I'm going to identify the shortlisted projects in no particular order, and then Angela is going to help us in reviewing the short videos that were submitted by these shortlisted projects to explain their work. The finalists in no particular order are New Commune, a social condenser of artistic, ecological, and social diversity by Team Jawe Lang Architecture in Malaysia. The Open Mind Center for Mental Health by Team Open Mind Center, TI Architecture Studio at the Kazan State University of the Russian Federation. The Shakti Sanrakshan Kendra Care Center for Women and Children by Team Shakti, TA Architecture Studio at the Kazan State University in Russian Federation. Castle Peak Health Center by Team NK3, NK3 Architects of Hong Kong. And the Mama Women's Clinic, Weaving Well-being into Lifestyles by Team Mount Gorillas at the Uganda Martyrs University in Uganda. And now Angela will play the short videos that these shortlisted projects submitted.
Camping Brew in Kuala Lumpur is the last Malay community in the heart of the city. The first is the absence of landowners, who have moved to other parts of the city for various reasons. The second problem is the lack of all-age community participation. The third issue is the need for communities to regain confidence in their residents and public life due to the recurrence of COVID-19. Kuala Lumpur city center, south of the Klang River, has fully embraced urbanization, and the modern Western lifestyle displayed on the surrounding billboards. The eroding towers are gathering silently, trapping Camping Brew in place. From the context of Camping Brew and the proposition of new countryside, the local cultural diversity, ecological connection, village change under rapid urbanization and public health contribute to a new regional character. In terms of form and function, starting from 4 quadrants of features, urban enclaves, systems and elements, we derive and imagine the prototype and construction of new commune through more detailed architectural features, urban silhouettes, mixed cities of multiple species, traditional Southeast Asian settlement architectural elements, and bastards architecture. By referencing local historical issues and a series of urban visions contained in the master plan, we hope to propose a new model of community and inclusive facility that encourages the community to participate in and counter the development of skyscrapers around the neighborhood. It is through the social cohesion of protection, integration, and art that new commune creates a social condenser that can convene people for positive dialogue. The major objective of this project is to address the enormous impact of urbanization on Camping Brew. It also aims to give voice to those who do not have a voice in the community. We must ensure that the metaphorical nature of culture, community and society of systems, structures and infrastructures is protected. A revolutionary paradigm is formed to counter this narrow capitalist ambition. Thank you for watching.
This is Shakti Sanrakshan Kendra, a project for SARE Center for Women and Children, the work of our team from Studio Tayarch. And Kazan State University of Architecture and Engineering is aimed not only at solving social issues through architectural means, but also at shaping a clear model of the future and the evolving role of architecture within it. In this project, we investigate the link between healthcare and social problems, striving to discover the most accessible solution. Statistics show Southern Asia has the world's highest intimate partner violence rates. India's cultural and social dynamics don't align with its economic growth. 1 out of every 3 women in India has ever been abused by a man. 31,677 rape cases were registered in India in 2021. In 2020, the number of complaints of domestic violence increased by 131%. We have identified a suitable location for the reconstruction, abandoned Shakti Mills in Mumbai. Infamous for cases of rapes, this site is located near some of the world's largest slums in the world. We suggest creating a public center for healthcare and children's protection on the former factory's main block. It involves 2 blocks, an enclosed area for assistance, rehab, and temporary housing, and an open public block with a market, communal dining, and spaces for district-wide social programs. We've addressed India's epidemiological challenge and designed our project for adaptability during outbreaks. Sliding panels, curtains, and walls swiftly convert creative spaces to hospital beds. With multiple entrances, crowd management is efficient. Natural light, ventilation, and antibacterial materials enhance a healthy environment. Our design seeks to craft a secure yet open, comfortable space employing traditional materials, ornaments, and motifs. We believe that this project can help not only women in difficult situations, but also influence the entire society as a whole.
NK3 Architects' initial focus was on rural sustainable healthcare in sub-Saharan Africa. We have grown into a diverse and international team across Hong Kong, Monaco, and London, focusing on architecture in both the healthcare and residential space, as well as continuing our work in the commercial sector. Our team was interested on revitalizing Tong Lao structures in the Sham Shui Po district to combat future pandemics, existing epidemics, urban decay, and strengthen Hong Kong's healthcare network. The design proposal incorporates 9 key solutions: heritage preservation and revitalization, site planning, cultural sensitivities, community integration, basic healthcare provision, education initiatives, mental health awareness programs, accessibility enhancements, and sustainable design practices. By adaptive reusing 2 traditional Tonglao buildings, with one of them being a second-grade historical building, the proposal respects the historical value of the building facade and keeps it while revitalising the plan for usage of the healthcare centre. Our green building design utilises an atrium as a passive cooling strategy to facilitate cross-ventilation, enhancing natural airflow and lowering humidity throughout the structure. The proposed facade system uses aluminium perforated panels supported by stainless steel channels and brackets. Modularity allows for flexible facade design. Our team has a vision to address the healthcare needs of the Hong Kong community by providing community engagement, cultural sensitivity, and a comprehensive range of healthcare services. We aim to enhance well-being, reduce stigma, and contribute to creating a healthier and more inclusive society.
Hi, this is Team Mount Gorillas, comprising of Aisha, Michael, Benjamin, Mark, and Stefan from Uganda. The proposed site is located along U.S.A Road in Kozi Village, PG District in Uganda, and is approximately 200 meters north of Kozi Trading Center and adjacent to Uganda Matters University and Kozi Hospital. The site currently acts as a guava frontier to Amala Students Hostel. There is a cassava garden in the south and a food shack in the north where students come and dine. In this community, there's a growing need for medical services, yet people are limited by the ever-increasing medical bills from the hospital. And surprisingly, some medical conditions could be avoided if the people change their lifestyles, for example, eating right, doing physical exercises, and being social, the more. Therefore, the project is to reuse the site as a women's clinic, seeking to explore how healthcare can be an integral part of people's daily living by weaving well-being into lifestyles. The design looks at the entrepreneurship, agriculture, nutrition, and playing lifestyles, and it includes a craft space and a vegetable garden, which weaves the clinic into the entrepreneurship and agricultural lifestyles of this community. These are intended, firstly, to help the community generate some revenue from the sale to cater for their medical bills, and also to create a platform where women engage with each other as they work. This fights stress, depression, loneliness, but also improves their hands-on skills, motor and sensory skills, and provides an educational experience. It also allows them to keep their bodies active as they're working in the gardens. Regarding nutrition, the food shack has been extended to provide plant-based meals rather than animal-based because research shows that they are more healthier compared to the latter. This would also help educate the community on healthy nutrition lifestyles. A kids' play area for children below 12 years is proposed, as their play gives joy and relief to their mothers as they watch them play. This also is healing and healthy to both parties. Cross-ventilation, solar and water harvesting and earth materials have been incorporated to have conducive spaces and also reduce energy use for a sustainable facility. Thank you.
Thank you. Thank you so much, Angela, for playing. What we saw were the 5 short videos that the shortlisted teams were asked to submit. And just watching the videos, you can see the remarkable amount of work and thought and consideration was given to the prompt of the community health center category, how the challenge of dealing with pre-existing conditions in adaptive reuse was a challenge in itself, but then to address issues of healthcare, to consider holistic design responses as the prompt asked for, to consider community health as being related to physical, mental, social, and spiritual aspects, to think about equity and accessibility, about materials in terms of their sourcing and sustainability, and to pay attention to all these issues of physical and social context, of the health implications of equity and inclusion, design innovation, and the representation of the project was really a monumental task. So it's my pleasure at this point to announce the winners of the 2023 Community Health category of the EUI international competition. I don't know, Angela, if you want to put up the slide, or I can just announce them as well. That's totally.
Please, you can
Okay.
please announce. So
All right, I will go ahead. So the honorable mention number 1 was New Commune, a social condenser of artistic, ecological, and social diversity by Team Jawe Lang of Malaysia. Honorable mention number 2 is the Open Mind Center for Mental Health by Team Open Mind from TI Architecture Studio at the Kazan State University of the Russian Federation. Runner-up number 2 is the Shakti Sanrakshan Kendra Care Center for Women and Children, submitted by Team Shakti TI Architecture Studio at the Kazan State University of the Russian Federation. Runner-up number 1 is the Castle Peak Health Center by Team NK3 of NK3 Architects of Hong Kong. And the winner of the 2023 Community Health category is the Mama Women's Clinic, Weaving Wellbeing into Lifestyles, submitted by Team Gorillas of the Uganda Martyrs University of Uganda. And I have to say, you know, we're giving great attention to these projects. The jury was incredibly impressed with the range and depth and thoughtfulness of all the projects. But I would just like to now give the jury an opportunity to make some brief comments on what they saw and what they were looking for in terms of the deliberations that they went through to arrive at the short list. And so I'll turn it over in order to Adam, Alan, and Tom.
Thank you very much. First of all, I wanted to thank the organizers for the initiative of this design brief and prize. It's been really fascinating for us to see the varied and interesting spectrum of responses. And what was really interesting for me as a jury member was to hear my colleagues and to articulate a conversation about the different projects and to see and analyze. They would call attention to one, I would call attention to another, and that way we would get to understand the projects a bit more for making decisions. And one thing I would really like to point out about all the finalists is their great attention to local culture, local needs, site-specific specificity, and tectonics or materiality. And I think in all of the projects we could see in different ways, obviously from different parts of the world with different material culture and different pre-existing conditions, really fascinating responses to the need for this type of architectural projects. The winning project in Uganda, I think, has an excellent conceptual diagram, and the implied constructivity and materiality of the project, which is fairly schematic, really promises to bring it to another level on site with the materials available in that area. The Hong Kong project has amazingly good diagrams, and it's very credible. I also wanted to point out the beautiful schematic designs in the Mumbai project. There's some really great schemes. It's actually funny, I think the videos tell a different story than the panels do, which is really, I would encourage everybody to look at the panels if possible. I don't want to take up too much more time, but I'd also just like to point out this overall sensitivity, which we noted in all the projects and mainly in the selected projects. There are a couple other ones that we would have liked to have been able to include as well, but obviously we couldn't do that for everybody. And I also wanted to thank my colleagues and the organizers one final time before giving the microphone over to somebody else. Thank you.
Thank you so much, Adam. Alan?
You're muted, Alan.
Yeah. First of all, thank you so much for the organizing such a very interesting, very relevant, and very ambitious competition worldwide. And really, I was, in the beginning, I was impressed, but also I wondered so many projects that we could work on it. And I said, this is too much. But then when we went through together, I find out some very interesting aspects. So my approach was simply to analyze in relation to health and how to prevent stress. So as public health scientist and architect, I find it. So some of them, they pay huge attention to main criteria of public health, lifestyle, what make people healthy. This kind of issue attracted my attention, and I could easily find out some of them and differentiate from the other. And the other aspect, how the quality of the zone could prevent stress. And that was also one of my criteria to come to that conclusion, which I must say I really impressed by that. And the first criteria that I look, it was really how key design factor related to lifestyle, what make lifestyle easier, healthy lifestyle, and then which one create emotion, because our emotion is enhance our health and well-being. And finally, also the experiences, what you experience within the environment in relation to greenery, in relation to daylight, in relation to spaces, make you feel good. So these three criteria I look easily, and then I could easily differentiate some project, and we come to conclusion. It was very funny to say that all of us, we did separately and we come to the same conclusion, which means really all of us three, we were agree, and there was no discussion to choose. That was very nice. Since I'm working many years with our International Academy Award, and we launch next week, actually, International Academy Award. You will see. We launch for the next year in Design Week in Milano, and I invite all of you be part of that. So, and the other issue that I look how this quality could prevent stress, and the building that design is really what we say comprehensible, manageable, and meaningful or not. So this I could analyze easily, and I come to a conclusion that the one that really in Africa was more interdisciplinary studied and much broader than others. But as our colleague also mentioned, the others has some architectural quality very high, but unfortunately was not more interdisciplinary. So, but in general, all of them, they have done wonderful job. I'm really impressed by all of them, and thanks to all of them that working so much. But this is a good experience to learn in this process, and hopefully by next time they will improve it. And I hopefully that next time will be much more better and better. And thank you to all of you, especially to Muhammad, to start this this meeting and this competition, which is really interesting for future students to learn from that and participate more. And thank you, Luisa, and thank you all my colleagues, Adam and Thomas. We had wonderful telepathy, I must say, without knowing each other. We understood, we come to the same conclusion. Thank you very much.
Yeah, so let me echo what Adam and Alan said. I also want to just thank the EUI team for all the support. And I also want to just thank everybody who submitted. I was really impressed by so many of the entries. There were clearly a lot of thought, a lot of effort put into so many of them. Just a couple other observations. One of the things that's really striking about every submission is how much they make a case that the current built environment is a very unhealthy place in most parts of the world. And so, we could not have sort of designed a more unhealthy built environment for ourselves had we tried. And so I think that this competition is really addressing the sort of profound need for a greater attention to public health globally. A couple other observations, how much our definition of wellness has expanded. It's not simply about physical health. As the Open Mind Project talks about, it's obviously as much a mental health challenge as it is physical. That health involves creating new kinds of communities. The Malaysia Project, for example, is really putting forward an idea that we lack a certain kind of third space, a certain way to create community in so many of our environments. And both the Uganda and India project in particular really put an emphasis on the health of women, children, and families as being critical to the health of communities. And both women and youth are obviously victims of violence and other dysfunctions in current societies, as well as sort of key to creating a healthier future for all of us. All three of the winning projects put a great emphasis on education, the fact that this is an ongoing process that we all have to learn what health and wellness means in our own lives, and that clinics go way beyond dealing with illness to trying to move us all toward preventative health and educating the population more generally about what it means to lead a healthy life. Sustainability and reuse were also really a big part of this. The recognition that we can't have a healthy human population without a healthy natural environment. And so that was also, I think, really encouraging to see. So in general, I thought all five of the top winners here did an impressive job, as did so many others that we looked at and it really admired. So again, thank you all for your work, and congratulations.
Thank you so much, Tom. Thank you, Alan, and thank you, Adam. Those were really great. Thank you. I'd like to now invite our commentators, Giselle and Lindsay, to offer their reflections on the overall results of the competition and the ideas that it raised. So thank you.
Sure, I think I'll start then, if that's all right. Great. Well, good afternoon to everyone. I'm joining you all today from Rio de Janeiro. And I just wanted to thank the organizers, Mohammed and Caitlin, Angela, Louisa, and the entire Epidemic Urbanism team for having me to comment on this really important design competition for community health centers. Many of the jurists mentioned very aligned thoughts, but as was mentioned, I'm Giselle Sabag, a trained architect, public health practitioner, and urban planner with a mission to improve urban health by design. I also have the pleasure of serving as the executive director of the International Society for Urban Health. So for the past 20 years, the International Society for Urban Health has actually been the only global non-governmental organization that is dedicated to advancing our mission to work across all disciplines and sectors to address urban determinants of health and health equity to attain a healthier future for all people in all communities worldwide. And we're especially interested in the ways that we can translate all of the vast evidence that's been gathered over the last 2 decades on the ways to build healthier neighborhoods, cities, into action and impact for residents on the ground. So regardless of geography or background or age or income. And obviously all the architects that are thinking about health, such as yourselves and everyone who, sent in an entry to the competition and everyone that's listening today are really key to reaching that goal. And the projects that were presented here really do represent important life-saving work and work that, my fellow architects, all of you all are out there doing every single day. So I think what I wanted to just comment on a little bit was the role that we all have to play. And so many of these submissions touched on the important ways that we can design and shape our built environments to support health, because whether we sort of recognize it or not, all architects, everybody who's touching the built environment, we actually are all health professionals. And what that means is that we're charged with either promoting improved mental, physical, and social health through design and through the structures that we create, or unfortunately, as was mentioned, much of the time, actually, we're accidentally, probably not purposely, hurting it and perpetuating some of those existing systematic health inequities, especially in healthcare. So, we architects, we have such a big, important responsibility, but my main point is that it's an important choice that we make every single day with every design decision. How is it that we're going to impact health? And I do hope that as part of this competition, that we'll all start to think a little bit more about the ways that we do have such an important impact on shaping health. And hopefully really consider that power that we have to improve health, because we do have a great opportunity. So, and just to comment on community health centers in general, very briefly, I know I don't have a ton of time, so I'll try to be quick. But we do have that really important role to play in shaping our indoor built environments to optimally support health and well-being. And we can do that through community health centers. But we also have an equally important, or arguably more important, opportunity to connect that building itself and its functions with the surrounding community. So I just wanted to take a quick moment to talk about the reason that I decided to focus my, my mission on public health and not only healthcare, and the way that these community health centers can actually make an impact on population health. Because public health focuses on preventing diseases and promoting well-being for entire populations and communities, and not just the individual. Well, of course, healthcare is a really important piece of that, but on the other hand, they are more concentrated on diagnosing or treating or managing individual patient illnesses or injuries once they have occurred, and healing people once they're already sick, and then putting them back into the environment that made them sick in the first place. It's really difficult, or virtually impossible, unless you're equally focused on preventing illnesses before they take hold, to make that really positive impact that sticks. And so that's also why I'm focused on cities and sort of our urban environment, because the majority of humanity does live in cities and the world is continuing to urbanize. So if we want to actually improve health and well-being for the most people, then we need to focus on how to design urban environments that support health, which is also why I focus on public health, and specifically, generally, I think in the built environment, one great area that we have an opportunity to impact is to prevent non-communicable or chronic diseases. Because if we can work sort of upstream in our communities before illness sort of takes hold, then we can change those determinants of health. And we have an opportunity to impact, millions or even billions of lives in a positive way. I'm sure that, we all sort of know a little bit about non-communicable diseases or chronic diseases, but those are the things like heart disease, stroke, cancer, diabetes, and they're actually the leading killers of death and disability around the world. And then, they're responsible at this point for more than 70% of all deaths that happen globally each year. And non-communicable diseases, they grow as cities and our built environments continue to grow and develop. So there's also this massive economic burden of designing cities that negatively impact health and drive more chronic disease burdens. And I know that some statistics that have been thrown around by like Harvard School of Public Health, for example, are talking about the cost of NCDs to the global economy exceeding $30 trillion. So it's really not a negligible economic impact either. So, we can improve lives, we can also improve economic opportunity for everyone and development for all of humanity, really. So I just wanted to touch on that, but also the fact that we have scientific evidence now. So what I think is, this is really good news. We know what the 4 main risk factors are that are responsible for the vast majority of non-communicable diseases. And many of the projects touched on these. So tobacco use, physical inactivity, unhealthy diet, and harmful use of alcohol. If we address those, then we can significantly reduce the NCD burden around the world, and especially in low and middle income countries, which bear the brunt of the NCD burden, with around 85% of premature deaths from NCDs occurring in those countries. So it's also really fantastic that we got so many submissions from those low and middle income country contexts where it could really make a difference. The other positive news that I have is that of the many factors that shape our health and well-being, so your genetics, those things you can't change, you're born with them, your environment, your natural built and social environment, and your behavior, you know, the choices that we make about diet, exercise, smoking, drinking alcohol, those main determinants that I mentioned. We know from the evidence that the leading drivers of death and disability globally are determined almost entirely by your environment and your behavior. And so why is that good news? Because your environment and your behavior are changeable. Your genes are the only thing you're kind of stuck with, but most research tells us that 10% or less of your health is determined by genetics alone, which means that the other 90% are actually linked to changeable factors that we as architects or built environment professionals have an opportunity to shift to support health and well-being and positive outcomes. So, you know, in fact, even your behavior. So sometimes people think about behavior as being really individualistic, but it's not. It is so highly influenced by your environment. Like you really cannot choose to walk if you don't have a sidewalk, or you can't, you know, have an opportunity to change your diet if you have nowhere to buy healthy food. So that's also an area that we can influence through our environment and through our built environment choices and design decisions that we make. And, you know, all of us as architects of our built environments, we do have this really tremendous amount of influence over how our environments impact our choices, our mental health, our social health, our physical health. And I think sort of to illustrate the impact that our neighborhoods make on our health, one thing I try to talk about is life expectancy differences within the same city. You know, in cities around the world, this is pretty shocking, actually. I think the number one predictor of how long you're going to live is actually the neighborhood that you live in. So babies that are born a few miles or a few kilometers apart, they might expect to live 65 years or 90 years based on the places that they spend time, and whether those places support or inhibit the health of the people who use them. So that's really an opportunity that these health, you know, these community health centers create to get back to these impressive projects. You know, I really do see so many important initiatives incorporated that support health and well-being of both patients and staff. And it's so important to consider the ways that physical activity, for example, is incorporated into the circulation patterns in the building. I saw that in a lot of the projects. You know, are stairs central? Are they attractive? Are they inviting? Are they comfortable? Are there spaces to stop and to socialize with friends or colleagues or loved ones? Are elevators the default or stairs the default? You know, we can design that actually into the interiors of buildings and the circulation patterns that we have. A lot of the projects incorporated sustainable design, which normally does include these days, you know, whether tobacco is allowed in or near the entrances of buildings. That's really important. And then what kind of food options are available for patients and for staff? You know, is there choice architecture that's incorporated to nudge people into making a healthier choice? Are there price incentives that are used to make healthy foods the best economic option for people? Are there also really unhealthy foods that are being served in the buildings? You know, those are all important considerations, and I saw a lot of the projects address those. And then, of course, the basic architectural principles that we know support health and productivity for staff as well, like the ample natural lighting and airflow designed into the spaces. Can patients control their own personal environments in meaningful ways? I saw that here in a lot of the projects that they are using environmental and sustainable design principles, which is so great. And, you know, how do those translate into impact on the users of the health center as well? So, but beyond the interior, so I know that we're all architects, so we think a lot about the interior, but there's also these really important design aspects reflected here to support community health beyond that of just the patients and the users of the building itself. So some of the most innovative community health centers that I've seen lately create opportunities to invite the community to come in and to use the spaces, even if somebody is not ill or having to visit that community health center. So I was excited to see a lot of that in these proposals as well. And some of that looks like incorporating outdoor, public, open or green space elements into the site, restorative gardens, community gardens, which I saw some of, walking and cycling trails, ample or flexible seating and shade trees, which can make a really important impact on encouraging physical activity. And then I really love the way that these proposals adapted and reused important buildings that were already embedded into the urban fabric. Because one of the most important aspects of the way a community health center can truly support holistic health and well-being of all users and the community is in the siting of the project itself. So within some of the projects, you know, had a different siting opportunity than others, right? But if we can be within, you know, dense, compact neighborhoods that are well connected to high frequency public transportation with safe, dedicated bicycle infrastructure and surrounding walkable communities with attractive pedestrian orientation access from the buildings, then the community can actually access a wide variety of the amenities nearby, including the ones available at the community health center. And that really adds something to the community itself. I know that we were also wanting to think a little bit about emergencies. So of course, COVID comes to mind, but we're going to have so many more epidemics that we continue to experience. And I would say in terms of those aspects, one thing that's gotten a lot of press lately is actually the epidemic of loneliness and isolation, which is a huge problem around the world, certainly in the United States, but also globally. And community design can also sort of directly address those aspects in key ways. So the way that the building is oriented to the community and the way that the neighborhood itself, brings people together. Then there's the basic health supporting elements become even more important and need to be amplified when we have emergencies that take hold. Like, for example, if you all remember, during COVID, we really, really needed ample open and public gathering spaces sorely. And it became such an important equity issue for all of us as to whether or not we had access to those places. Community health centers can help us provide that and can help provide that to everyone in the community, regardless of whether they are, have an opportunity at green space or open space in their own backyard, which is usually reserved for really high income folks. And,
Thank you.
I was thinking,
sorry.
Oh, that's okay. Am I out of time?
No, I think, please finish your sentence, Giselle. I didn't mean to cut you off, but did you want to?
That's okay. I just have one more.
Okay.
Yeah. So I was just thinking, if we could imagine that community health centers actually provide this critical emergency infrastructure to prepare for and deal with emergencies when they happen. And that's a really exciting opportunity. So just, last thought is through thoughtful siting and open and ample community use and health supporting design, both inside and on site, community centers can substantially improve physical, mental, and social health for many community users, as well as patients and staff. And if we focus on opportunities for incorporating physical activity into everyday life, making healthy food the easy choice, and adding ample green space and creating inclusive, comfortable, fun, and public open spaces for all that includes seating and shade and amenities, many of the leading killers of people today can be prevented upstream. And if successful, one day, maybe we're so successful that we actually shift the needs and goals of the community health center to serve health education and prevention rather than treatment once largely preventable illnesses have taken hold. So thanks so much for your time and for letting me comment on these exciting projects.
Thank you so much, Giselle. Lindsay.
My turn. Well, what can I say? I think I am the only environmental psychologist on the panel today. If you don't know what environmental psych is, I'm not surprised. It's sort of a relatively young subfield of psychology where we focus on the transactions between people and place. And that place could be indoor, outdoor, it could be anywhere. It's a large field. But transactional in that, of course, we change places and places change us psychologically, as well as physically. And Alan and Thomas and Adam and everybody has touched on so many wonderful aspects and facets that actually relate very well to environmental psych. And in fact, I think we're all speaking the same language, just with a different, maybe vernacular and saying the same thing. And I won't take up too much time either, but I think what's interesting is that in all of these projects, they do talk about the tenets of environmental psych. We need spontaneous social interaction, we need privacy, we need access to nature, we need a sense of mystery and beauty and legibility and coherence and all of those things that we've already talked about. But as a researcher and a scholar and an editor, and certainly as a thinker, thinking critically about these things, I hope that they've taken the body of literature that environmental psych offers and maybe built in some of these projects ways to measure whether or not they're doing what they say they should or that they intend to do. I always look to see if there's some pre-design work done to maybe then compare against a post-occupancy evaluation done later, not just one, but a few, especially with users, but also with community members. So particularly with this group of projects, it's an amazing opportunity to gather data from those in the neighborhood to see whether or not the community center or whatever it is that they're measuring is actually working for a number of different users and special populations and so on. And there's many ways to do that. And, you know, there's lots of methods, and there's certainly a lot of literature to read and get ideas from in the Journal of Environmental Psych, which I am the co-editor in chief of. So there's lots of lit to draw on, and especially similar to what Giselle was saying, this idea of access to nature, especially in pandemics or public health emergencies and so on. Even here in BC with wildfires and air quality and so on, it's really essential for people to have a place to go to access nature. It's certain that access to nature is a mental health benefit and an emotional benefit. And so when communities and municipal governments and cities and areas like that make it so that we can get frequent access to those, it's a wonderful thing. And I think that came through some of the projects, maybe not all of them, but some of them. Anyway, I can't stay past the hour, so I'm gonna wrap that up. But yes, if you're interested in environmental psych, given that this is a teaching venue here, definitely look up the Journal of Environmental Psych. And given that I'm the past chair of EDRA, look up Environmental Design Research Association as well, because it's a wonderful organization. And we're so happy to partner with EUI.
Thank you so much, Lindsay and Giselle, for those insightful comments. And it's just been a pleasure to have spent this hour with all of you. I wanted to congratulate the 5 winning entries to the Community Health Center competition 2023 for EUI. But I'd also like to add that, and of course, thank the panelists. Thank you so much to you and Adam and Thomas for all the work you did on the jury. Again, to Lindsay and Giselle for those remarkable comments. And to the organizers, to Angela and to Mohammed, and of course, to Caitlin, who established the EUI with Mohammed. But I'd just like to end on the largest thanks going out to everyone who submitted, all the people who put in such work, such compassion. This was really an effort that I think in this day when everything is bad news, I really feel positive and motivated and about all the remarkable work up there, to all the students and teachers who put together projects, to healthcare professionals and architects and designers and psychologists who all worked as teams. And so the 2 words that I'm left with were really coordination and compassion, and what we can do if we all work together. So it's been a remarkable experience, and thank you, everyone. That was really great.